I have an LPC. I've been in the field for over 25 years. My beginning part of my career was very different than other people's. When I was doing my master's degree, we actually had to participate as a patient. So I went through 4 weeks of eating disorder treatment and 5 weeks of chemical dependency treatment before I was allowed to do my internship. So being on the other side and seeing how people really experience things helped shape me as to how I became a therapist. I've worked in big hospitals, I've worked in PHP programs, IOP programs, inpatient programs. I've worked with a variety of different clients. I've treated eating disorders, anxiety, OCD, chemical dependency, self-harm, and of course, complex trauma. One of the things that I do really well with is working with complex trauma. And the other population that I've been told that I work really well with is people with borderline personality disorder, which is also stems out of early developmental trauma. So I have a very significant history treating patients over the last 25 years with a variety of different disorders. I've also worked with every age group. My favorite is working with adults. My last job was in a strict DBT program, so I'm very well educated in DBT, and I'm one of the DBT leaders at SunCloud Health, and helping bringing that to our patients and giving them a framework for recovery. So I have a really interesting story of how I came to be at SunCloud. Before SunCloud even opened, I had applied to SunCloud. And after my initial interview there, I'm like, one day I'm really going to work there and work with Dr. Kim and the whole team at SunCloud, because I believe the treatment that SunCloud is doing is very different than any other treatment I've experienced over the years. One of the things that SunCloud does very differently is we let people actually talk about their trauma, and we actually do treat complex trauma. We don't cut people off while talking about trauma. We don't tell them they can't share certain details. We let them share whatever they need to share, and we create a safe environment where they feel safe enough to do that. If another patient should have a reaction while that's going on, we work with also managing the other patient while that's happening, which is a very different approach from most treatment centers. From my experience working with trauma and let's say a hospital setting is we were always told to not let people share details or no storytelling. And that always makes it difficult to actually work through things, because then you can't actually say what you need to say. The really cool motto that we have at SunCloud is that everything is speakable. Everything can be named and everything can be talked about, which again is very different in other treatment centers. The other thing I want to say about SunCloud in my experience is that we've had a lot of patients who've been through various treatment programs, and by the time they get to us, they're kind of done with treatment. And the really cool thing about SunCloud is by the time they leave our program, they feel very differently, and they feel like SunCloud made such a difference to them, and it was a different experience than they ever had anywhere else. And I have to say that that's one of the coolest things about being on this treatment team, is that we provide a different kind of treatment for patients that's not massively produced right now, and it's a very special environment to work in.